Gary and David. Thank you.
Awesome. Awesome.
Thanks, Lori.
Thank
What
you.
we thought we'd do is, you were all asked if you had questions in advance to submit those. So we got several questions in advance. We thought we'd get those out of the way and then get to the subject matter. We found that not all the questions had to do with waivers, but you know, we're all family here, so it's conception or resurrection, as we say in our organization, and everything in between. So we'll start with the questions you had in advance.
Okay, well, so I will start off by reading the first question for Gary. So, parents as shared living provider for adult dependent, can that be done?
So if you have an individual option waiver and it's only available through the IO waiver, and you have an adult son or daughter living with you and they plan on living with you for some time, you can be named what's called a shared living provider. You can do that as an independent provider, or you can work for an agency that's certified to provide homemaker personal care and shared living. At that point, you'd get a daily rate. The way I explain it to families is you essentially become a foster parent for your own son or daughter. It can only be done for adults, and it only can be done if you're on the individual options waiver. You can continue to have another job, and your adult child continues to live with you, and you get a daily rate. You would be considered an independent contractor. That daily rate usually averages about $100, but if your son or daughter has some complex needs, it could be $169. It just depends on the score you have on your developmental disability profile.
Acuity range, right?
Right.
Okay. Second question, how to get a waiver? My son will be 22 in February.
Okay, so
February 2021.
Okay,
Sorry.
so it used to be that you would call your county board and say, I want a waiver. And they would put you on a list, and chances are you would be waiting for years on that waiting list. A law was passed a couple years ago that we're going to change the way we do things, because we had, was it over 40,000 people statewide? 48,000
Yep.
people on these waiting lists. And the state did a survey of, Kent State actually did it. They called people on the waiting list and said, what are you waiting for? Over half the people didn't know what they were waiting for. Someone told me to get on the waiting list, so I got on the waiting list. So now when you call your county board, you have to express a need. And the county board is mandated to do an assessment. We're going to put it up on our website under resources so you can see the assessment. And it's a series of questions. Even to get on the waiting list for a waiver, you have to demonstrate a need either in the next 30 days or in the next 12 months. If you can't demonstrate that you have a need for help in the next 12 months, you can't even get on the waiting list. So what I tell parents, the advice is you've got to describe your child in a worst case scenario. We usually say, you've got to describe your son or daughter, your loved one, like they are on Saturday night when the meds have worn off. You know, it's not based on what they can do, it's what they can't do and don't have.
Yes, it's a funding system that's based on what you can't do. So you have to keep that in mind.
We also wanted to stress that we're going to be doing a 2-hour session on May 6th.
May 6th, starting at 9:30 to 11:30.
Right, so we'll be sending out information. We'll advertise that with Lori. We usually do it through the Educational Service Center there in Cuyahoga Falls. And they have their parent mentors come in. So they typically open it up to family members.
Okay, next question. How secure is the waiver that my daughter finally received?
It's pretty secure. As I've said many times in these presentations, waivers are about 60% federal funds, 40% local or state dollars. So your waiver is guaranteed by the federal government. Unless there was a major shakeup in Medicaid, it's pretty secure. The only way you would lose your waiver under current circumstances is if you no longer were Medicaid eligible. So Medicaid eligibility in Ohio is you can't have over $2,000 in resources. So always make sure your loved one doesn't have over $2,000. That includes if your son or daughter gets a job at Giant Eagle and has a pension, that pension can count as an asset. So just make sure they never accumulate more than $2,000. There are a whole other series I'm sure Lori will be doing on stable accounts and trust funds. Those are really critically important. The government, I always say the government considers our loved ones the worthy poor. There are legal ways to shelter your income and assets that won't make you ineligible for Medicaid. And you always have to function at what's called a level of care.
Yes.
This can be challenging for parents who consider their kids high functioning. High functioning's code for maybe doesn't qualify. A level of care for our waivers means you function at a pretty low level. Now you can be a genius, but because of your social skills, you're not functioning like the typical community and you're going to be okay. But if you're learning how to drive, you're learning how to get around the community, you go to the local store and not many people really actually recognize that you have a disability. If you're no longer functioning at an intellectual level of care, even though you may have a high intellect, it could be iffy. The other way that you could lose your waiver will be if the team gets together and determines for your health and safety, you've got to do certain things, and you just refuse to do those. The county has an obligation to maintain your healthy and safeness. That's not even accurate.
Health and safety.
Health and safety.
There you go.
So if you just ignore that, I've never known it to happen in Ohio, but the county could say you're ignoring health and safety, therefore we can't guarantee it to the federal government, and therefore we're going to disenroll you. The final way you could lose your waiver is not to use it. We had about 800 people a couple years ago that were at risk of losing their waivers because they didn't use them. They thought they were going to get the waiver so they could get a Medicaid card, and they used the Medicaid card, but they did not use their waiver. You have to demonstrate sometime throughout the year that you need it. If you don't need it and you don't use it, you lose it. Many parents of that 800 said, I didn't use it, Gary, because I didn't know how to use it. No one told me how. So these are important things.
Okay, next
Okay,
question.
sorry.
No, that's
25
okay.
minutes, okay.
If we feel a little rushed, it's because we're trying to stay within our time frame. So, supported living, but my son does not have an IO waiver. He has a level 1 waiver. So it sounds like this question is related to supported living versus shared living.
Yeah, so I think there was just some confusion. Supported living is an old term for smaller unlicensed group homes. So if I'm moving out and I'm living with a couple other guys and I'm not on a waiver, I'm on local tax dollars, that's been referred to as supported living for years. Shared living is what we described before, that I'm living with a family member or I'm living with my unrelated paid provider. That's shared living. And yeah, you have to have an IO waiver.
Yes,
You
yeah.
can't have any other kind of waiver and get that service.
Okay. I am getting some conflicting news that my 21-year-old daughter on the autism spectrum, who is filed under our tax as our dependent, can receive a stimulus check. Is this true or false? I thought she would not receive as an individual, as she is filed as our dependent in yearly tax filings.
So what we've been finding over the last 2 weeks is the Treasury Department keeps changing their mind. Right now, if you've claimed your adult son or daughter as a dependent, we're being told you won't get a stimulus check. But if you have a son or daughter that's getting SSI, Supplemental Security Income, or SSDI, Social Security Disability Income, they will get a check. Most people on SSI and SSDI have not yet received those checks, and they don't have to file anything in addition.
Okay.
And the last one's
We have
on unemployment.
Yeah, the last one is my adult daughter also works, but does make about 100 per week until she got furloughed on March 15th. She also receives monthly SSI adjusted to offset her income. We never filed for unemployment for 2 reasons. She did not make enough to qualify, and I did not want to mess up her monthly SSI. Did I do the right thing?
I think probably if your daughter's already on SSI, you probably are reporting or were reporting her income on a regular basis. If she doesn't have that income, her SSI should go up. But the other thing to remember for all the adults who are on SSI, you should have some type of room and board agreement with your adult son or daughter. To get the maximum SSI payment, SSI was given to you so your adult son or daughter could pay you room and board. And if you're not charging them room and board, government thinks you're giving it to them for free. So to get the maximum, which is closer to $800, you need to charge them room and board. You need to take it out of their bank account and put it in yours. But I think you probably did the right thing. But make sure Social Security knows that he's not getting or she's not getting the $100.
Okay.
Okay, that was fast.
Very fast.
So what we thought we'd talk about, and I know there probably are people on the call that don't have a waiver, don't have Medicaid, and some of this isn't going to make sense. But we're going to dive into what you get once you have a waiver. Remember, if you don't have a waiver, contact your County Board of Developmental Disabilities and explain your need. Also go to our resource page where we'll hopefully have it up by tomorrow to look at the assessment tool. Sit down with a friend and answer the questions on what the need are. One of the reasons we changed the old waiting list law was that most of the people at the top of the waiting list were senior citizens. They were 70 and 80-year-old parents with 50 and 60-year-old sons and daughters. And every time their number came up, the county would call them and say, Dave, we've got a waiver for you. And they would turn it down, but they'd stay at the top of the list. And they turned it down primarily because our senior citizens thought a waiver meant a group home. A waiver does not mean a group home. A waiver means it's a funding stream. A waiver is not a place. It's an amount of money. We have 3 waivers under the DD system: the level 1 waiver, the self waiver, and the individual options waiver. What we tell families is get on the waiting list by demonstrating a need, practice that assessment tool, answer in worst case scenario, and know that if your son or daughter is an adult, you have no legal responsibility to do anything. You have a moral one, but you don't have a legal obligation. The state and the county understand that, but the more you say you will do, the less likelihood you're going to get a waiver. The other thing to keep in mind is attend these kind of trainings. Knowing the language and the buzzwords is critically important. Know things like natural supports will be thrown at you often. Natural supports is what you do voluntarily as a mom or a dad. But the key word is voluntarily. And you don't have to do it over 18. We're going to do it. But when you say, sure, I'll do that, okay, well, it's obvious they don't need it for this and they don't need it for that. Your needs can sometimes be as simple as, my son's graduating from high school. He needs something to do during the day. He needs job training. So in most counties, the kids that are graduating from high school are given higher priority. The younger the child is, the less likelihood they are of getting a waiver unless they've got a lot of complicating issues. If you have autism and significant behavioral issues, you're self-abusive, you're abusing the other kids in the house, you're going to have a shot. But if you're 5 years old, your parents are still doing a lot of things for you. And the assessment is going to compare your child against a typical child. And the closer your child is to a typical child, the less likelihood you're going to get a waiver. And remember, a waiver is not a place, it's a funding stream.
Can you talk a little bit about, if you have an identified need, it doesn't necessarily mean you get a waiver?
Right. So thank you.
Okay.
So the other thing that was changed in the law is maybe my need is I'm just as as a parent, really stressed out because I have a child with a disability. But if I could go out to dinner with my wife a couple times a month just to relieve the stress, I might be able to get by, and my family might be able to stay together. Every county has something called family support services. And if the county can offer you a sitter to come in 2 Fridays a month while you go out to dinner, and that keeps your family together and you're stressed down, you don't go on the waiver waiting list and you don't get a waiver, you get help for your need.
Right, they're meeting the need with local funding instead of utilizing the waiver.
It could even be a piece of technology would really help me. If I could have some cameras in my house, the county can offer you local funds to buy those cameras, and you don't need a waiver. But the other thing to keep in mind, especially if you've got a child with medical challenges, maybe what you really need is health insurance from the Medicaid card. The county's not allowed to give you a waiver so you can get the Medicaid card, even though you get a Medicaid card with a waiver. Remember, this is usually a 2.5 to 3 hour presentation. So the other thing to keep in mind, it is absolutely true that you have to be eligible for Medicaid to get a waiver. And it's absolutely true that if you have a child under 18, the entire family's income and assets will be considered. But if the county board offers your child a waiver and they're under 18, Job and Family Services waives family income and assets, and they only look at your child.
They still might ask the question.
They may still ask the question.
Yes.
Because those caseworkers at Job and Family Services can't get to the second page without getting your income and assets.
Right.
So play the game with them, but it can't count against you. So if any caseworker is saying, you know, you live in a nice house, you drive a Lexus, your kid's never going to get a waiver because they're not on Medicaid,
That is not true.
that's not true. If offered a waiver, they will only look at your child's income and assets. And it doesn't matter if you drive a Lexus and live in $1 million home. It's what your child has as assets. Okay? So the reason we're not in Kansas anymore is because of the pandemic. Most of the things I just talked about are getting waived. So there are lots of things going on. Once you get a waiver, we're in waiver land now. If your child is 18 and over, you have always been allowed to be a paid provider for your own adult son or daughter. Within the last several weeks, the state asked the Department of Medicaid to waive the requirement that parents cannot provide paid services to their minor children. I said that backwards,
Sure.
I think. But currently, during the pandemic, if you have a child on the level 1 or the IO waiver, you can be hired by an agency to provide paid services to your own son or daughter. The reason that happened was you might have been lucky enough to have a 16-year-old at home on the waiver, and you got laid off, and your child can't go to school. And it's probably not safe to have strangers who are service providers coming into your house. The states recognize that. So they've said that if you've got a 16-year-old on a level 1 waiver and you can get an agency to employ you, you can be paid to take care of your own son or daughter who is on a waiver. Any agency that's certified as a homemaker personal care provider can do it. There are very few that are doing it. The ARC is, but ask around in your county and ask your SSA. Every SSA director has been trained on this, who should have passed the information on to the local SSAs. But we've got hundreds and hundreds of SSAs across the state. So sometimes it takes a while for the message to get out.
I think the big question we hear from that one is, should I go through the hassle of getting the training and the certification and all that stuff if it's only going to be a couple weeks? Well, the reality is we don't really know how long the pandemic's going to last. So I would recommend that, yes, if you feel you need to get that service provided to your loved one, that it's worth it, even if it's just for a few weeks.
Right. Now remember, on the level 1 waiver, you get $6,750 a year worth of support. That averages out to about 5 hours a week, but it's 5 hours a week that you're going to get some income and you're going to be with your son or daughter. So I think it's worth it. There are estimates that this pandemic could go on for another year, and we just don't know what temporary means. For those of you who have adults on waivers and all the day programs have been closed down, the requirement that day services happen in a day service area have been waived. So a day service provider could, I don't think this is going to be happening, coming into your home, or they could be doing a Zoom for day services in your home, or if you've used up all of your funding in your home budget, like that $6,750, you might be able to tap into that day service budget so that you could get a homemaker personal care provider at home.
We're getting lots of questions.
Okay, we probably better get to the questions, and we'll come back anytime.
Sure.
We'll even we've talked about doing one of these face-to-faces in Akron. I think that's always, once this is over. So what?
Okay, so I'm gonna go through some of the questions here because they're rolling in. So I've got a question from Lisa about shared living. Can the guardian of the adult be the shared living provider? That's first part of the question.
Okay. Yes. So there are no rules in the Department of DD saying a guardian can't be the provider, but the Ohio Supreme Court several years ago found, and it wasn't parents, but they found some paid guardians that never went to visit their ward. So the Ohio Supreme Court adopted a few extra rules. And one of them is that the local probate judge has to give you permission to be a provider. Honestly, the Summit County judge is one of the tougher ones in the state. Most of the rural judges, they've known you since birth, and they're not going to have a problem with it. We know of families in Summit County that are guardians and paid shared living providers. If there are people in Stark County, we know that too.
Typically, they
shared living in Summit is the more challenging one. That court really looks at it more carefully. But yes, it's possible.
Second part of that question is,
how do you navigate the training?
And does the shared living provider need to be certified like other HPC providers? We are having trouble navigating all of the training.
Okay, to be shared living, you can either be an independent provider and bill the state directly, or you can work for an agency.
But you do have to meet the training requirements of the rule.
So the training requirements at this point are all online. The state of Ohio, the Department of DD, has a free website. You go to it and do the training. It's an open book test. Typically, you have to get CPR and first aid training face-to-face. The Department of DD has waived the face-to-face rule until June 2nd. We expect it to be extended, where you can get online first aid and CPR training. I've checked it, it's $15. The challenge is getting a background check. Even though you're providing services to your own son or daughter, you have to have a criminal background check. As an independent provider, that becomes more challenging because there aren't many places open to get it. If you work under an agency, the agency can employ you, start the process, and then has a couple months to actually get you a background check.
Up to 60 days.
Up to 60 days. So it's a faster process going through an agency, but be very cautious. There are no rules on how much the agency can keep as an administrative fee for employing you. So ask about that.
Okay, next question from Jill. Will my child be ineligible for Medicaid if his grandmother claims him as a dependent on her taxes?
No, it shouldn't. It's really, Medicaid eligibility is based on the income and assets of the child. So if the child has a waiver, grandma claiming, because SSI is not going to cover all expenses. So it shouldn't affect eligibility if it's claimed. It will affect the stimulus check but it won't affect Medicaid.
Okay. Next question is from Beth. My son receives SSI, but we claim him as a dependent on our taxes. Can he still get the stimulus payment?
We're being told no.
That's the answer today.
And that's the answer today. I should say everything we say today is effective today. The reason they're giving us for the no is because you got a deduction on your taxes. And so instead of the $500 a child would typically get, you got a deduction on your taxes. If you're claiming an adult, it's probably the difference between a $1,200 stimulus check and a $200 deduction. So, but we're being told no. If you're claimed as a dependent, you don't get a stimulus check.
Okay, another question from Lisa. Have you heard of HPC on behalf of support / ABA? I'm not sure if I completely understand that question,
Right.
Lisa. Can you explain what this is or where to find on any DD site?
Okay, so ABA is not going to be listed on any state site with waivers. ABA is a brand name, so you're going to see things about behavioral intervention, but you're not going to see the letters ABA. But where you can find information about homemaker personal care services is you go to the Department of Developmental Disabilities website, Ohio Department of Developmental Disabilities, and click on rules and laws, and then click on rules in effect. Mm-hmm. That you'll scroll through all of this stuff, and you'll see homemaker personal care. Homemaker personal care is the largest billing code under a waiver. That's someone that can come into your house and help you take a shower or give you a shower, help you do dishes, learn how or do the dishes for you. But a homemaker personal care provider can also do things on behalf of an individual. So I can either take you grocery shopping or I can do grocery shopping for you. But it's a billing code. What some families have done is they name a homemaker personal care provider in their plan who happens to be an ABA therapist. And if the ABA therapist is willing to accept the rate paid for a homemaker personal care provider, they're not doing ABA therapy according to the state. They're providing homemaker personal care services. And what is ABA? It's reinforcing doing those similar things.
Lots of questions coming in.
Can I repeat family support?
Can you repeat family support services piece? Also is paid provider through MRDD.
Okay.
Contact SSA ? So.
Okay, every county has a program called Family Support Services or Family Resource Services. Yeah. Family Resources is an older name. It's a combination of local tax dollars and state dollars, mostly local dollars. So if you're in Summit or Cuyahoga or Medina, most of the money is local dollars, and you're going to have a lot more money available than if you're in Tuscarawas County, for example. Every county is different. The eligibility on that is a family income eligibility. It's a sliding scale. So middle income families and above may not even qualify for it, but Family Support Services, and the ARC wrote the legislation 30 years ago, was to keep the family together. The law is very broad. It's whatever you can convince the county will keep your family together and keep your child with a disability within the family home. The example I use is Clark County, west of Columbus. Years ago, there was a family who had a well for their water, and their pump broke. The only way to keep the family together and the child at home, because they couldn't afford a new water pump, was for the county to buy a water pump for the family. It's that broad. They bought a $100 water pump for the family. It kept the family together. Most often in most counties, Stark County, for example, gives little vouchers.
I was going to say they're sometimes referred to as FSS vouchers, Family Support Services vouchers, which go through the county board, but they come through what is called a Council of Governments.
Right.
The COG.
And those vouchers can be used for all sorts of things. in most cases in Stark County, they're using them to go to summer camp. So it's very broad. You do have to work with your service and support administrator. That's what an SSA is. It's your caseworker. And every person that's asked for services from a county board gets an SSA.
Okay, a couple more questions. From Beth, has the requirements for independent providers changed due to COVID-19?
No.
There's some rumors out there floating around, I think, on social media and stuff.
No, they haven't changed. But one of the reasons, for example, that only an agency can hire a parent of a minor is because of that rule that an agency can take up to 60 days to get a background check. You can't even begin to become an independent provider until after you have a background check. So the state's major practical worry was, we don't know how long this temporary is, so why even bother with an independent at this point? There is a whole other discussion about whether independent providers are actually what are called independent contractors. And there is a belief that Ohio is violating wage and hour law through the Department of Labor that was from way back in the 1930s about what it really is, an employee or an independent contractor. And some of the discussion in social media is a memory of Governor Kasich saying, we're not going to have independent providers anymore. I don't think, with everything else going on, I'm hearing nothing about independent providers going away. The requirements are exactly the same. And it's actually, David is actually on many committees regarding the certification of independent providers.
Yes.
They put too much work into that to just delete it.
Right.
So nothing like that is happening. It's not even being discussed at the State House.
Lori, I'm assuming you're going to see all these questions too. Do you want us to keep going down the list, or?
We're okay if it's all right with you.
People are not dropping off. If let's get through it, we can.
Okay.
Some of these I think we could probably consolidate a little bit, but I'm fine as long as the audience wishes.
Okay, you just let us know.
Okay, thank you.
All right, we have another question from Lisa. Shared living again. If another HPC provider works with my adult child, can I still be paid for a shared living day?
Okay.
So
It's a good question.
This one?
Yeah, it's a good question. Because this is one of the changes.
Yeah, so I guess we could approach this in two ways. The way the rule was written before is your loved one can receive HPC daily rate services and shared living, just not on the same day by the same provider.
Right.
You talk about what the change is now.
So remember, shared living is like being a foster mom for your own child. So either the state or an agency gives you, here's $100 a day, Lori, you're responsible for 24 hours. The old rule says, well, Lori's getting $100, so we're not going to bring anyone else in to help her. We're giving her $100. But with day programs closed and with school closed, the other temporary change is I can give Lori $100 a day, and I can also send someone into her house to help her out because Lori's got a job. She works at the Autism Society of Ohio, and she's got to go do her job. So because she would otherwise be working, we can send in another provider. And oh, by the way, it can even be by the same agency. So that has changed.
Yeah.
We're working with a family in Butler County down near Cincinnati where mom's a shared living provider, and they're bringing in someone else to help her because her son has such significant behavioral challenges. She needs someone there all the time with her, but she's not working because of the layoff. So she's there getting the daily rate. And then there's also someone else there working 40 hours a week to help her if he has a behavioral outburst. So that's only temporary again.
Yes. Yeah.
And we've got permission from the Department of Medicaid, and that'll be rubber stamped, we think, by the federal government.
Okay, next question from Beth. Can you get the stimulus check if you have not filed yet and do not claim him on the 2019 return?
Yes, but there's an age thing going on. If the child is under 17, you're going to get $500. and it doesn't matter that your child has a disability or not. If you've reported that you have a child under 17, you're going to get the $500. For an adult who is on SSI or SSDI, you shouldn't have to file anything. But we're being told that they won't get their checks maybe until as late as mid-May. I have to tell you, my mom is on Social Security, lives with me. She's not received her check yet. She's on traditional Social Security, and she makes so little, she hasn't filed taxes in many years.
Okay, I'm not sure if this next one is a question or just kind of a statement. It's from Lisa. HPC on behalf of supports was offered via Zoom, and I need to figure out how to use.
I don't know of any homemaker personal care services offered through Zoom, but there are some adult service providers. So your son usually goes to a workshop.
Mm-hmm.
Workshops are now allowed to do a Zoom adult day program with your child at home. Personally, I don't know how that can happen, but they're permitted to do that. And they're also permitted to send traditional workshop staff into your home to provide homemaker personal care services.
So the federal definition of homemaker personal care is, there's two kind of separate definitions of that, right?
Right. It's either hands-on providing the service
on behalf of the person.
or
so
on
I could see how, because someone here is responding saying, my daughter's getting HPC hours through Zoom.
You're allowed to do on behalf of.
Yeah,
I'm trying to figure out what that would be through Zoom. Traditionally it's grocery shopping, or I'm going to pick up your meds, or your doctor needs some paperwork, I'm going to take it to them for you.
It's probably very similar to like remote support, right? In some ways.
Yeah, if your plan says I'm going to work on my alphabets, and your homemaker personal care provider can do that through Zoom, and you've got the capacity,
yeah,
I would think you could do that.
Yeah, she's learning math skills and skills via Zoom. So
right.
There you go.
Yeah, that's it.
All right, next question from Beth. You have to live in Franklin County to be a provider through the ARC. No, the ARC Family Choice Program is a statewide program.
So if you're interested in that through the ARC, you go to the ARC of Ohio website, thearcofohio.org.
Yep. Click
on Family Choice. The first question we ask you on the application is, have you talked to your SSA? Because everything flows through the county board. And we have a staff person that'll call you and help you through the process. In Summit County, actually, we've been able to turn around parents in 2 days, because Summit County's actually been very cooperative in getting this done.
The other thing I want to go back to, one of the questions earlier was about BCIs, and I think a lot of your local county
Explain
boards,
what a BCI is.
Background check. So if you're looking to become a provider, that background check investigation can typically be done at your local county board.
Right. Okay.
Hey, Gary, I'll just jump in and say that we're actually using the ARC right now for my son, and there is a place open in Stark County that Chelsea knows about. So Chelsea works with here in Summit County, and she knows about a place there in Stark County that is open for the background checks. And yes, y'all did a great job turning us around within just a few days. And so I will say that's worked really well here.
Right.
Okay. Awesome.
And again, the training is all online. It's not. I helped write some of the rules. I don't know that it's a test, and I used to be a teacher. It's not a test that I would have presented, but it's open book, and you can take it as often as you want. It's supposed to be an 8-hour test. It doesn't take 8 hours if you're good at reading and going back and being able to answer the questions.
I think that's the confusing thing about the certification. When people talk about that 8-hour, training initiative, it's called 8-hour, but it doesn't take 8 hours. I mean, I think on average it might take an hour to go through that process.
Right.
And all of our training, you go through what's called an orientation video, so it kind of walks you through everything.
Okay.
There's
that's
no more
all
questions.
of our questions.
So I think we're.
Yeah, and really call us anytime. I don't remember the 800 number. Do you? I know the regular number. No one. You don't have to dial long distance anymore. But
sorry, I'm trying to keep up with
it's
another.
area code 487-4720. Or you can go to our website, get us information that way. We're out and about all the time. Like I said,
Normally.
normally we're not allowed, but we'll be glad, to come up and just do a face-to-face even. And these are fun face-to-face, actually.
They're so helpful, and I've said it before, Gary, you're just an incredible wealth of information. I always learn so much when I sit through your presentations. And let's remind everybody, May the 6th, they're going to be doing one through the Educational Service Center. We will put that on Facebook and on our website as well. And that's a much longer presentation and something that can go into a lot more detail. I've sat through that. That is very worthwhile to do that one as well. And you're doing that, though, via Zoom, right?
Yes.
Right.
Yep.
And that's what they like is whatever's happening in Columbus and whatever anyone wants to know about. So we talk about education, health, the Department of Developmental Disabilities, opportunities for Ohioans with disabilities. It's, again, what I said, we do conception to resurrection services and supports. And so anything anyone's dealing with, that's what we deal with.
Someone did have a quick question. The final one says, may I know how much it would cost to become an independent provider?
It's typically about $150
To the state.
but that's the fee to the state. So you have to pay a fee to the state to apply.
Mhm.
You have to pay fees for the background check. You have to pay fees for
CPR
the
first aid.
CPR and the first aid. And then you're considered an independent contractor and have to pay your own taxes. That works for many, many people. Working for an agency, most agencies will cover those fees either upfront or what we do, for example, is if you've worked for the ARC for 4 months, we reimburse you for any fees. Or currently, if those fees are preventing you from supporting your kid, we'll help you out with those. But understand, as an agency employee, even though the salary looks less, you're covered by workers' comp, unemployment, and Social Security. You're not covered as an independent provider.
And we do all the administrative work, billing, paperwork.
Right,
all
and an
that.
agency does all the billing. If you've got a child with cerebral palsy, you're going to get a back injury. I mean, I can't lift. I grew up with family members with cerebral palsy. I can't lift today because of that. So that workers' comp really comes in handy. What do you see the future for adult and
What do
day
you
school?
see? Beth has a question. What do you see in the future for adult day in school? How can you do distancing and mask wearing with individuals with severe needs? What protective measures do you see? That's a big
So
one.
with school, if you listen to Governor DeWine, he's not saying anything really about school in the fall. So we really don't know what to project with that. Director Jeff Davis came out with a statement today saying, don't worry, parents, we're not opening adult day services anytime soon. But those adult day program providers can do the Zoom, or they could have your adult son or daughter come to their facility, but in no groups no more than 10.
Including staff.
Including staff.
Yep.
So that even includes, so you got the big workshop room, that can be divided off into sections. You can't have more than 10 people in one room, and they're going to have to be seated 6 feet apart. That's going to be challenging. My concern as a fellow family member is, what about the van ride to get there?
Right.
There's no way you can sit 6 feet apart in a van, and I don't believe they'll be able to financially operate a school bus 6 feet apart. So
they might require the parents
Yeah,
to drive and drop.
they could.
Yeah.
But the other issue is most of the day program providers are making their money off of the transportation rather than the day services. So just be cautious. I've got a promise from Jeff Davis. No one's going to force your adult son or daughter to go into a program like that.
Does everyone know who Director Jeff Davis
Yeah,
is?
Jeff Davis is the director of the Department of Developmental Disabilities. He's been in the system a very long time, just a good guy. He's a member of the governor's cabinet. So he's in charge of all of this stuff. Regarding wearing the masks, follow the guidelines. But as you know, as family members, we're in a system that you can't maintain 6 feet distance. I mean, our loved ones need help dressing, bathing, eating, redirection.
Hand
They're
over.
not going to leave that mask on.
Right. No, they're not going to leave that mask on, you know? So I get calls daily from moms, especially saying, please don't let them make me send my kid out of the house. Another reason why parents of minors can be paid. If you have any one of the waivers, level 1 self or IO, parents have always been allowed, if their son or daughter is 18 or over, to be a paid provider, either independent or an agency. I did want to point out, one of the challenges on the self waiver is that you have to go through a company called Morning Sun. Even if you have an independent provider, that independent provider has to be employed by a company called Morning Sun. You don't have to use Morning Sun. If there is an agency in your town that does participant-directed homemaker personal care, you can ask your provider to be employed by one of those agencies, and it will go much faster. We employ people on the self waiver. The only difference is that if you go through Morning Sun, you can negotiate the amount of money that your provider gets. If you go through an agency, there's a standard rate traditionally. I know United Healthcare or the ARC is going to pay what it pays. They're not going to be able to negotiate because they've got other employees.
Okay, awesome.
Anything else?
Else you guys have, or?
Well, thank you both again so much. And you know what? We can always do a part 2 because I could ask you 5 questions right now. So,
It's all good.
given the late hour. But again, thank you so very much. And look for everyone who's listening. We do this every Thursday evening at 8 o'clock. And please join us again. And we definitely will have the ARC back and go through some more things. Thank you so very much.
Awesome. Thank you.
Bye, everybody.
Bye.